Hi and welcome back to Psych Nurse. Today's a little bit different. I've got to still put some more posts out around therapeutic communication and different types there are, which I'm going to do. I sort of laid back a little bit last week, only because I kind of felt I was bombarding people with new videos. So I'm going to slow it down a little bit, maybe just do one or two a week. As opposed to sort of doing one every day. So that's why I kind of took my foot off the gas. But if you notice behind me, I've got like a green screen and I'm just trying it out today. I've never used one before, so I'm hoping that what you're seeing going on in the background is something that makes it look a little bit more interesting to look at, I guess, and more aesthetically pleasing to you rather than just looking at my boring mug. So anyway, what have I been up to? I've been working pretty hard this week, as you know. Working in psychiatry is never a dull moment. And so I've had some interesting characters this week. Had a gentleman that was clearly floridly psychotic, which was, can I say, interesting to see. As most people, they can have symptoms of psychosis, but a lot of people have been drug affected, but this one was a pure relapse of schizophrenia, which was interesting to see and interesting to talk to and interesting to try and manage and build up that rapport that sometimes you want with your patient, particularly when they're at that stage where they're so unsettled and dealing with paranoia, dealing with distress, and talking people down and getting them the treatment that they perhaps need, or get them assessed by a psychiatrist to let them decide. Kind of makes your job worthwhile, doesn't it? I've dealt with a quite severely suicidal person this week as well, which is always a challenge, not just to engage with, but also to document as well. Only because you want to firstly protect yourself, you want to protect your organisation, and you want to protect your patient, of course. And there's fundamentally a system to follow when documenting, which I would advise you to definitely work on documentation skills and always try to improve them. Not because you have anything to fear, but I guess when it comes to someone else, it's kind of like there's lots of different ways you can look at it, really. There's kind of the way that you want to be able to read back on that note and see exactly where you were, pick up where you left off, and you also want other people to be able to come in on their shift and see what you've done and feel confident that what you've done is in place, and then they have to do this. There's a clear instruction, and it looks at risks and things like that as well. So, and when it comes to handover, you can hand over something a bit more comprehensive than just some subjective information. You could be more objective about things and giving people a clear presentation of what you've observed and what you've spoke about, and what plans you put in place, and what recommendations you have, and your impression of the patient as well. So these are all things that are interesting to do. So when you're in a quite high profiled part of mental health, this is something you have to learn to do a little bit more quicker, a bit more thinking on your feet, and in different areas you can take a more longitudinal type assessment rather than something that's just a snapshot. So there are different types of assessments as well that you can use, and evidence that you can use it with, and you can combine that with history and everything else. Anyway, look, documentation is a massive thing. So yeah, it's been an interesting week. So I've had someone that's been floridly psychotic. I've had someone that's been acutely suicidal. And an immediate acute risk, needing a place of containment, a place of safety, and further assessment. So I've ended up working with the police this week as well, visiting and going out to people's addresses, which is great to actually work with our other emergency services. And I do class us as an emergency service. People call an ambulance and it's to do with mental health. They want to speak to a psych nurse, or they want to speak to someone in psych. We are an emergency service in my book, and we accommodate crisis and try to deal with it as best we can. What else have I done? I haven't really done much else apart from that. I haven't done much else apart from that. I've done pretty much lots of things, but nothing of super great interest. Okay, so anyway, look, I'm just trying out this green screen. I just want to see that, you think that it's something that could be, good to look at, and, different ways I can use it. If you want to comment, or, just tell me, what you think of it, and it's too much, not enough, let me know. All right, thanks a lot, and I'll see you again soon with some more episodes of the different types of therapeutic communication that's on offer to all of you people that engage with clients that have mental health problems. So until next time, thank you very much. If you like, please click the like. That would be really, really nice. I'd just like to know that you've actually enjoyed what I've done. If you haven't enjoyed it, put the thumbs down, even, whatever it is that you feel about it, feel free to comment. All right, lovely. So see you next time. Take it easy.